Hello, I'm Dr. Demerjian. The reason why I'm making this video is to educate you on the use and the fitting of the dental sleep appliance that is sent to you from the sleep center. You should be receiving a box like this. As you open it, there will be a pink pamphlet in there that is from Somnomed. Read all the instructions. It goes over warning, warranty, cleaning, wear and tear. They're also giving you 3 cleaning tablets. Use those about once a week, where you drop the mouthpiece in a container with a tablet and some water and it will clean. As you take your box apart, you're going to take out the blue part, and then when you take that out, this is the mouthpiece. Underneath there are impressions in there. Those are the impressions we took in the beginning. And in the front part of this are the models. Those you need to keep for safekeeping, just in case if anything happens to your mouthpiece, we can send it back to Somnomed to get it repaired. So now what you're going to do is you're going to open the lid and take out your mouthpiece. Okay, I'm going to pull out my sample here. So what you're going to do is, I want you to put in your mouthpiece 30 minutes to an hour before going to bed for the first week and sleeping through the night with it. The reason why I want you to do that is for those 30 minutes to an hour, I know it's going to feel bulky, it's going to feel like you've got a football mouthpiece in there, but you're going to get used to it and you're going to be able to fall asleep with it. After the first week, you just pop in the mouthpiece and go to sleep. So the mouthpiece is going to look something like this. It'll be 2 parts. The upper will have an orthodontic expander. The lower has these 2 little wings that are adjustable. So when you put in the mouthpiece, I'm going to take my model here. When you put it in, always put in the upper front teeth first and then push the back into place. Then you put in the lower front teeth first. And with your index, you'll be putting it back and pushing it down. So I'm just going to do it that way, pushing it in place and then biting it in. As you remove it, you're going to use your thumbs at the molars and you're going to slowly wiggle it up. I'm not going to do it on here, but I will just slowly wiggle it up from the back and it comes out. And then you're going to take your index fingers, go to the way back to these bumps and slowly wiggle it down to pop it out from the back. If you pull from the front, most of our teeth are angled forward and it'll put a lot of pressure on your front teeth, and that's what we don't want to do. There are 2 ways to adjust this mouthpiece. The upper is an orthodontic expander, the lower are wings. So underneath your container here, if you unscrew, you're going to get a little container. As we pop the lid, there are 3 pieces here. There's a tiny brush for cleaning. This middle piece is something that I have added to your container. This one is colored. You may get a purple one, a pink one, or a clear one. I have put one in your container for bite use, and I'll explain that in a minute. And this is the key on how to adjust your mouthpiece if needed. So coming back to your mouthpiece, we're going to take the lower part. If you're wearing your mouthpiece for the first week or 2 and you're doing great, no more snoring, waking up rested, don't mess with it until you come back and see me at the sleep center. But if you start having some snoring and you're still waking up unrested and tired, we need to do an adjustment. So what you're going to do here, as I bring this closer, if you look closely in the middle there, there's an L carved into that side for left. And up here it says L0 in the plastic. Looking on this side in the middle, there's an R for right side and R0. So as you come back to your little container here and look at it, those were zeros on the mouthpiece. If I twist it, holding the top and twisting the bottom, there's L1, left 1, right 1, L2, R2, L3, R3. So what happens is, Every time you move up one number, the jaw moves forward 1 millimeter. And so what you're gonna do is you're gonna take this key, you're gonna lay it flat against the teeth on the inside and fit it inside the hole here. With your both thumbs and index, you're gonna be pressing and squeezing until that key goes all the way through. Once it's in, I'm gonna use my other thumb to keep pressing it in as I stand this key up. Once I stand this key up, that little wing is gonna raise up. And now once it's up, I will pull it out, take another number higher, snap it in place to move the jaw forward. So you're gonna take a look at it. There's a little slot there. The groove is to the back and to the inside. You have to line it up. It perfectly fits in there. And then you're gonna snap it in place. If you do it this way, you may hurt your thumb. I like pinching it and snapping it in. And so when you change one side, you're at zeros on both right now. When you're gonna advance, you're gonna take the two ones and make sure you put them correctly. Make sure the writing is on the outside and the flat end is to the back, because every once in a while somebody puts it on backwards. In the mornings, when you wake up, take out the mouthpiece, give your jaw a break for about 20 to 30 minutes, brush your teeth, do whatever you're gonna do. When you come back to see me, I will make you a morning repositioner called the AM aligner, which I can't do at this time because we're on lockdown, but I have sent you a little rubber piece. So after 30 minutes of letting your jaw relax and letting your teeth slowly settle into place, you're gonna take this piece, you're gonna use the long end, put it at your front teeth. I will do it on this model. What you're gonna do is, this is your normal bite. With the mouthpiece of opening the bite, bringing the jaw forward, your jaw may like that more stretched forward position and more relaxed muscle, but I want to keep your bite where it is. So what we do is, you're gonna use this rubber piece, you're gonna fit it in there, and you're gonna bite, and you can see how it's pulling the jaw forward as I angle it upwards. And you're gonna squeeze on that for about 5-10 seconds and repeat that for a couple of minutes. And then you're gonna go to one corner eye tooth and do the same thing, bite and squeeze, relax. Other side, bite and squeeze, trying to get your back teeth to fit together. Other than this positioner, and you can use this for several minutes, I am giving you some bite exercises. So if you go to this instructions, go to the second page. Number 4 is the AM aligner, which I am not making for you, so I'm giving you that bite piece. But number 5 goes over 2 bite exercises. These you can do in the morning and anytime throughout the day to get your bite to resettle into place. If you adjust your mouthpiece where it stretches the jaw out too much, you may have problems getting your teeth back together, and you may need to stop wearing the mouthpiece for a little bit until the bite settles back into place. It's very important to do these exercises to keep your bite where it is. So one of the bite exercises here, you put your tongue to the roof of the mouth, pull it back, and bite on your molars. So it's going to look something like this. Tongue, back, and if you watch my chin, and bite on your back teeth. The second one, I call it the chin rest. Basically, you're going to be using your palm, pushing your chin backwards. I'll just use my fingers to demonstrate. As you push back and bite on your back teeth, you're pushing your joint back into place there. It's very important as you're using the mouthpiece, if you have minor issues, such as some of the symptoms that we talked about, a little bit of sensitivity, a little bit of even muscles or jaw soreness, that's okay. But if you start having severe pain, something does not feel right, stop wearing the mouthpiece until you are able to come and see me at the sleep center. Cleaning instructions. Every day you should be brushing and cleaning your mouthpiece. Every morning, every night, every time you brush your teeth, you should be cleaning the mouthpiece as well. Once a week you can use these tablets. Somnomed has given you a few samples. Once you run out, you can try using something over the counter, but I don't recommend using it more than once a week. As far as cleaning solutions, best thing to use based on the instructions given by Somnomed is to use a detergent type soap like Dawn or Palmolive. And if there's a little bit of extra toothpaste left on your toothbrush, that's okay to scrub it and clean it. But by you keeping it clean will make these mouthpieces last longer. So any toothbrush, just make sure you get in there all along the inside, all around the cracks where there could be potential places where the plaque and bacteria can be getting, even around the wings here and on the inside. All right, that's it. I think you're good. Thank you.